So I've read a lot about shifting costs from the federal to the states in terms of medical coverage, Medicaid coverage.
Yep.
Can you? I don't really understand how that works. Could you explain for me and for the audience just how that's going to work?
Yeah. Yeah. So we talked about we were mostly talking so far about one of the big provisions on the Medicaid side, which is
Mhm.
this new work requirement. But another set of changes are changes to what are called provider tax arrangements. And this gets really technical really fast, but let me try.
Okay.
So the way the operational control of the Medicaid program exists at the state level, but a lot of the money comes from the federal level. In fact, a substantial majority of the money comes from the federal level. And
Mhm.
the way it works is if the state spends $1 on the program, the federal government, depends on exactly what the spending is and who it's on, covers some fraction of that dollar, say, around 60% of the dollar on average. And so states have figured out that if they increase what they pay to their hospitals, that allows them to get additional federal money. So if they increase what they pay to their hospitals under the Medicaid program, that allows them to get additional federal money.
Mhm.
And then if they tax that amount they just paid to the hospital back from the hospital, they've drawn down additional federal money, but they haven't actually had to spend additional state money in order to do that.
Interesting.
And
Wow.
so these types of schemes have functionally allowed states to shift costs on their Medicaid program onto the federal government. And so one of the things the bill does is make it harder for states to shift money in this way.
Hmm.
Now, I think it's absolutely true. And defenders of these types of policies, what they often argue is like, listen, the Medicaid program is never designed to operate this way. And it's, unreasonable to allow states to do this. I think the counter argument is even with these types of arrangements in place, Medicaid is in practice a very lean program. It tends to have very tight utilization controls. It pays healthcare providers much less than other forms of insurance. And as a result, even when people do have Medicaid, they often have more difficulty accessing care than people with private insurance or with Medicare coverage. And it's also the case that states are often make it pretty hard to enroll because they're trying to keep their costs under control.
Hmm.
So while I think one can look at it in the abstract and say, these types of provider tax arrangements are not the way you'd sort of want to finance the Medicaid program in a perfect world, just telling states you can't use these financing arrangements anymore and sort of shifting those costs back from the federal government on the states is potentially going to lead states to do a set of things to their Medicaid programs in terms of tightening utilization controls, paying providers less, making it harder to enroll, that are going to have a set of fairly negative consequences. So, my perspective is I think it would be better if we didn't have these types of financing games in the Medicaid program. But from my perspective, the right answer to that is to get rid of these types of financing games as the bill does, but
Mhm.
then reinvest that money in a more rational set of ways of financing state Medicaid programs so that we don't have the negative consequences for coverage and access to care that
Mhm.
I think, the set of changes in this bill are likely to have.
Thank you for listening. If you like the show, please be sure to subscribe, leave a review, and share it with a friend. It really helps. I'm so grateful. My tax guide, Taxes for Humans, is available for pre-order at sunlighttax.com/book. This podcast is for education and entertainment only. Nothing in this episode should be taken as individual tax or financial advice. You can find all the tools, books, and links I reference at sunlighttax.com/podcast.